Hey, this is Rick Cassell from exercisesforinjuries.com. I'm here at livetoplayfitness.ca in Cloverdale, and I'm doing some videos for the blog, and I'd done a blog post a little while ago, and a couple people asked me to do a video about it. And what it was for some clients, they end up having knee pain, and the knee pain might be due to poor core stability. So a lot of us are fine standing nice and upright when our trunk's upright, our spine's nice and on top of each other. But when we kind of move into that squatting position or forward trunk position, our clients will lack that core activation, strength, and endurance. So we might have to take a step back from doing the squat and then getting them to go into that quarter squat position. And I'm going to get Claire to go through it and kind of highlight a couple things. So you're just getting them to stand hip width apart. You're going to get them to engage the core utilizing whatever system you want. You can use like a bracing system, and then just going into a little quarter squat position, and then back up into standing and relaxing. And what I'll do sometimes is I'll get them to kind of put one hand in front and one hand on their back, so they can feel their core activate. They get a little bit more feedback of their body because they have their hand in front and hand behind. They're bracing, and then they're going into that kind of quarter squat position and back up. So I've just gotten to a little bit of a hold. I can progress her on to like a 10-second hold, and that's kind of the first exercise. And then after she's kind of mastered that, I can start bringing in different types of movements. So I can train her in that trunk forward position. So the exercise 2 would be getting her to brace, get into that forward trunk position, and then I can start getting her to do like a back exercise. Okay, and back. I can get her to go into like a rowing movement, and I can just end up going alternating back and forth. So I can get her in that quarter squat position where she's really working on activating the endurance and strength of those core muscles. Perfect. So that's something to kind of think about and look at for yourself and your client to see if they have knee pain. It might be because they end up having poor core stability going into that squat movement. And try those 2 exercises. Just bending in the hips, holding that quarter squat position, and then adding movement. So this is Rick Cassell from exercisesforinjuries.com. We're at livetoplayfitness.ca. We'll talk to you soon, and we'll see you on the blog or on another YouTube video. Take care.